Welcome, everyone. I am so excited for today. I think this is such an important group of medical affairs leaders because every session I've been in at Medical Affairs Professional Society, MSL Society, MAST, Fierce, everywhere, when we hear medical affairs talk about the top three things that they do to drive value in their organizations, insights is always in the top three. And so having this group of people together who are responsible for the insight generation processes and programs in your organizations is really exciting to me. I'm so excited to share some of the things we've learned about the important parts of this role and how it overcomes some of the common challenges for insight generation. For those of you I haven't had a chance to meet yet, my name is Scott Thompson. I am co-CEO at Acceleration Point. Over the last 10 years, I've worked with over 40 medical affairs teams, specifically in the areas of medical excellence to help improve processes and help drive technology within the organization, helping to drive more value and save times. This session is specifically for those of you who are in the insight lead role, the person responsible for ensuring that the insights are actionable, that they get used by the organization. Now, for some of you, this might be a full-time job, right? We do work with teams where they have full-time insight leads. For some of you, it might be part of your role in medical excellence or operations. Maybe it's part of your role as a field leader, part of your role as an MSL or TLL. Maybe it's part of your role as a medical director or strategist. Let us know what is your role with insights. Just put A, B, C, D, E, or F in the chat, and let's just find out kind of what everybody's role is that we should be focusing on today. All right, so we've got a couple of full-time insight leads. We've got some medical excellence folks, lots of folks from the MSL role, part of the medical director strategist. Okay, we've got a few others. Awesome. Okay. Excellent. So most of you are doing this insights work as part of your role as an MSL. We also have several folks who are doing this as part of their field leadership role or strategist role, MedX, and then we have a couple of full-time leads. That's awesome. I really do think that we're going to see more and more full-time insight leads just as we continue to make the processes better and more valuable and more visible within the organization. Fantastic. So today, if everybody has already printed out the worksheet, it looks like this. So please get that out. If you don't have a chance to print it, you don't have a printer in that home office of yours, just grab a piece of paper and draw 3 circles that overlap like this, and you'll be able to follow along just fine. Sometimes it's not what's taught, it's what's caught that really makes the biggest impact when you invest time in something like this and have to bring it back and use it in your organization. So we're definitely going to want to capture some of the most important notes that you get out of today. And we're going to actually start right down here in this bottom right section around challenges and goals. Because before we jump into the critical role that the medical lead has to deliver, it's important to understand why. And so we're going to take a look at the 3 primary challenges I hear almost every time that I am working with a new team in insight generation. Okay. So the first one is I always hear from the field teams that my insights disappear into the black hole. So the first challenge is the black hole. Now, at first people might say, well, this is something that is just hearsay. However, what I'm seeing is that it's even coming out in recent studies. So McKinsey just released a report this year that less than 1% of field insights are ever even read by their organization. Okay? Even read by the organization. We never end up hearing, here is how that insight was used. One of the things I do when I start working with a new team on improving this process is I go talk to MSLs. I talk to people that are doing social listening. I go talk to people that are doing lit searches, all the people that contribute to this process and say, what 3 decisions occurred over the last year as a result of the insights you brought in and people don't know. Okay. So that's the first one, the black hole. All right. The second challenge that I hear is what I hear from the home office team. So the home office teams What they're telling me is that the data that comes in is not actionable. It's not something that I can take action on. Okay. Now, here's why I'm hearing that. First, sometimes I hear that the data that came in isn't aligned with a strategy or decision that I have to make, right? If it's not aligned to a decision I have to make, a strategy, then I can't use it today, right? Second thing I hear is that sometimes the data comes in and it's not detailed enough, right? It's already too summarized. I don't know if I heard that from 100 people or 5 people or 10 people, who they are, where they came from, what their background is. So they're not getting enough detail to use it to feel confident in making decisions. Sometimes it's because it comes in too late, right? I hear people say, hey, I was trying to make a decision. I asked for insights. I couldn't get them fast enough. And so it's nice to validate something that I did or didn't do, but I didn't have it in time to make a decision. And the other one that I'm hearing a lot, and I'm seeing as I've worked with some teams, is that if you're turning in summaries to the organization of the insights that you're generating, is that when I look at the raw data, it doesn't match the summary, meaning that there's this echo chamber. There's this kind of bias that's happening in the debrief process where the things that we're telling the organization are important are a reinforcement of the things we already thought were, because it's not showing up in the data. So we need to make sure the data is solid and that it's really actionable and people feel confident in it. And the third challenge that I'm hearing is that the process, for those of you on the phone that are responsible for this process, is too burdensome. And so it's taking too long. It's taking too much effort in order to achieve the reporting at the speed and the frequency that's needed. I've got some teams that do insight reports once a quarter, some that are doing once a month. But I mean, there are some teams that are launching products that need insights every day or every week, or they're trying to generate reports at the end of the day at a Congress, and they just don't have the processes and tools in place to be able to do it that rapidly. So those are the three primary challenges that I'm starting to see. What I would love for you to do is just in the chat, put 1 or 2 words about your biggest challenge, the thing you're trying to overcome. You could write black hole, not actionable, burdensome, or something else. What is the biggest challenge that you're trying to overcome? Let's see. Okay, it's time consuming, too burdensome, that they're not actionable. I want to hear from everybody. Let's really take time. Too burdensome, not enough time to do it. It's not scalable. Yeah, as you move from something that you do once a month to once a day, it becomes really hard. Or from 1 team to 5 teams. Knowing what's a good insight, what is actionable, being able to pull in sources from different data sets and compare them. Awesome. Not insights, but also call notes. Not sure. It's not clear. We don't have a clear medical strategy to know what to go get data about. Awesome. So these are very real challenges. They're not just the ones I'm seeing, but you're experiencing. You're already stretched thin. What we're going to do is I'm going to walk you through, I'm going to show you how the role of medical insight lead can actually overcome these, right? Because what we'll do is we're going to go from data that goes into the black hole, and we're going to talk today about how to ensure that the data that's coming is valuable, right? If it's valuable, it won't disappear into the black hole. The second thing we're going to do is talk about how the role of the insight lead makes the data and the insights go from something that is not actionable by the organization to something that is driving impact, to something that is impactful. And then the last thing we're going to do is we're going to talk about how to go from a process and the use of certain technologies that make something burdensome into something that is scalable. Okay. So that you can adjust and change your insight process as you need. Okay. Now, in order to do this, in order to get to a point where we are able to go through these roles, talk about how to drive value, make sure things are impactful and build scale, we have to start with why are we generating insights to begin with? Why are we even doing this to begin with? So I want you to just take a moment. This is maybe the most important part of the insight lead role, is clarifying why is it we're generating insights. And I would love for you to just type in the chat, why is your medical affairs team generating insight? Okay, why are you generating insights? Just put it in the chat, type it out, a sentence or two. Why are you doing it? Like, what's the point? What's the value? Okay, to identify gaps, help advance the field, develop local strategies. Ideas and information. Awesome. Drive strategy and tactics. Excellent. Okay, to bring a voice of customer and to bring value and change patient care. Yes, the gaps in the strategic plans. To change a mindset, to communicate with leadership, to bring value to KOLs and acting on insights to give us change in future patients. Absolutely, I am 100% aligned. And if I was going to summarize everything that you just put into the system down to really just two things. The two things that I would say is that we need to be able to measure impact against strategic priorities, and we need to increase confidence when making decisions, right? So measure impact against strategic priorities and to increase confidence when making decisions. See, if we can ensure that we're doing those two things by bringing in the insights, that's going to be valuable. It's going to be impactful. I'm going to show you how to do it in a systematic way. Okay. So let's drill into this role of the field medical lead here for a moment to our data. So let me just switch over to this. All right. So there's three important parts to the role of the field medical lead. Okay. The first, and we're going to go into each of these in more detail, is to prioritize and direct the insights strategy. Okay. So most teams that start insight generation, and even teams that have done a lot of work to improve insights over time, have a very reactive approach to insight generation. They go out, they have engagements, they have conversations, and they're listening to things that are important and are then somewhat randomly bringing back insights of what they happen to have heard. Okay. We need to, in order to make insights insightful, we have to understand who we're bringing those insights for, what decisions they're trying to make, and then go get insights and go get data that helps support that decision. Right. So I'm going to walk through the three things that we do in order to make that happen. But that's the first role. We have to prioritize and direct our insight strategy. The second is that we have to gather confident building data. Okay. We need to make sure that all of the sources that we're using to bring in data that helps us to identify insights are being done so in a way that helps us gather confidence, right? So we need volume, we need specifics, we need breadth, we need it from specific specialties, we need it from different sources, because the more of that we have, the higher our confidence is in that data so that we can go make a decision off of it. And then the last one is we need to facilitate an insight to action process. See, big organizations struggle to take action on insights unless there's a documented, facilitated, planned, purposeful process for getting that done. So we have to put those processes in place and be able to do it in a way that is scalable so that we can do it quickly. And really what's great about this is that if we prioritize and direct our insight strategy and know what the decisions are that we're trying to make as an organization and bring back data for that, and we gather confidence building data, guess what? That's how you make the data and the insights valuable. right? And if we facilitate a process to bring back to those people the data that we get, right? So we have confidence building data and we have a process for managing it. That's how you're going to make an impact, right? It's taking the potential of the insight and facilitating a process to make it impactful. And if we use a process I'm going to show you today to facilitate those actions and analyze the data in a way that is aligned with those strategies that you're trying to support, that's how you're going to make it scalable. Okay, so these are the three outcomes we're shooting for. These are the three key roles of the medical lead, and I'm ready to jump into each one. Along the way, if you do have any questions, do please just put them right there in the chat. I'm happy to tackle them as we go or get to them at the end if we have time. And let's jump in. So the first role, prioritize and direct an insight strategy. Okay. There's three things about that role that we find is the best practice that we need to achieve. The first is we have to define alignment measures. Define alignment measures. So there is a belief across medical affairs, I believe it also, that the reason we do what we do, generate data, get it validated within the medical community, teach it, engage on it, bring back insights on it, is that as people better understand the data we're sharing, changes the beliefs and the mindsets of the medical community, and that those changes in belief get shown through action that improves patient lives. Okay. And so in order to do this, we need to add structure to how we measure and capture that. And the way that we suggest you do that is that for each one of those beliefs that are affecting the decisions being made in practice is to define it and then to put anchor statements against it and collect data against that as you're having engagement. And so in this example of quality of life importance, you should start by writing a fully aligned statement, right? HCP believes that patients' well-being and everyday experiences are key measures of treatment success. Then go to what is the negative alignment? What would it sound like if somebody does not believe this? HCP believes that quality of life is too subjective and variable from patient to patient, not useful. And then figure out what's in the middle. And see, the reason that it's important to have this is that you want to be able to measure change over time, but you need to calibrate. See, if we were all in one advisory board having a discussion about this, and 40 of us heard all the same thing at the same time, we could calibrate afterwards. What did you hear? What did that mean? But when you take 10, 50, 100, 300 people in the field and send them out to go have interactions and they're assessing live, or you have a team doing social listening, or you have a team that's doing market research, or you have a team, collecting insights through other sources, you need to calibrate in advance, or else we're going to end up with miscalibration and unusable data at the end. Okay, so that's the first one, really important. Establish what those are, and we'll talk about collecting data against it here in a minute. The second is that you want to then bring in data that helps support real decisions that are being made. And those are created, and a lot of you already do this, through key insight questions. Now, here's the trick with key insight questions. First, it has to be aligned to strategy, right? So you as the insight lead need to be spending time talking to your strategists, talking to access and reimbursement, real world effectiveness. You can see a whole list of people that you need to be engaging with to find out what decisions are you making in the next 3 to 9 to 12 months. And if you could have an advisory board with 300 HCPs and ask them some questions so that you could feel more confident in those decisions, what would you need to know and who would you need to know that from? Okay, then write the key insight question and think about what are the possible likely answers you might hear. Most of the time, it's not some unlimited number of answers you might get. You're going to hear one of 4 or 5 things, and maybe there's an exception. So Figure those out, document those in advance, because it'll make it easier to generate the data, easier to analyze it, easier to quantify. And then the last one is that you need to then have a deployment plan. See, what a lot of teams do is they'll create these questions and then they'll just put them out there without any pressure in the system or prioritization. This is what really helps prioritize. Out of all the things that we need to learn or want to learn, what are the things that we need to know now? And so when you do a deployment plan, you should know the purpose of that deployment, explain why it's important, know the insights you need, who needs to be providing that, where do you want to hear from, what specialties, what would be an amount of data that would actually make you feel confident? Go ahead and ask the person who's making a decision. Do you need to hear from 20? Do you need to hear from 100? What do you need to feel more confident? When do you need the answer by, right? If we all knew that we needed an answer in 2 months, we might act differently than if we needed it by end of year. So establish that. Figure out those key insight questions, make sure everybody understands them, and then think about for each of those questions, what are the various sources that would be helpful and valuable at answering that question, right? Most of the questions you might deploy to the field. You might go, wow, these couple of questions would be really interesting to see what they're saying online, or I bet they're publishing or speaking about this. Let's do a lit search, right? So it's important to really think through what are those various sources at this time. Okay? So that's the first role. The second role is to gather confidence building data. So when we think about bringing in data, the teams that are doing this the best, and you as the Insight Lead can help shape this and make this happen, the first thing that they're doing is they're integrating structured and unstructured collection. Okay, what does this mean? Okay, this means that when they're collecting data, they have their key insight questions, and they tend to have a multiple choice selection saying they believe this, or they believe this, or they believe this, or this is what they do, this is what they do, this is what they do. And then they have a place to document why. The why is so much different. It's much more precise per person. And so that's why you still need the nuance of that unstructured data that goes with the multiple choice response. And you can always have other as one of those answers and just get that in the why. Okay. Now, the best practice is to really combine these two pieces this way. And here's why. If I was to train you all day to walk through a wall, right? And I said, hey, I want you to walk through the wall right here. And I teach you and I run, what is an insights training? What is an insight training? Over and over and over again, because I want you to walk through a wall here, but the door is over here. The moment I leave, you're still going to walk through the door, right? If you want to change what you're getting, the most impactful thing you can do is change how it's set up. So simply by having your collection tools be set up in a way where you say, here's what somebody believes, multiple choice. Why do they believe it? You're going to automatically get better results in the data that you're bringing in than running the same training on what is an insight over and over again, because the moment that that pressure of the training is done, they're going to go back to what's simple. Okay, so change that. All of your tools are able to be set up that way. So let's do this. So where do you collect your insights today? Are you putting them into the CRM only? Are you using Quello, XY, Kernel, spreadsheets, PowerPoint? Just put your number in just so that we can find out kind of who's using them. If anybody needs help, knowing how to set up your particular tool, just shoot me a note afterwards. We've helped people with spreadsheets and PowerPoint and SharePoint do the same thing that you can do in Quello or CRM. So just let us know, but it's good to know kind of where you are today. Okay. So most people are using CRM only. That's fine. We have a number of folks using Quello. XY is probably okay. And lots of people in spreadsheets and PowerPoint. Yeah, that's a good place to start. And there are ways, even in spreadsheets and PowerPoint, that you can start to structure the collection more this way. Okay. Very good. The second thing that we need to do in order to gather confidence building data is that we need to leverage multiple sources. So a lot of teams will generate insights across multiple sources, but they don't integrate the data into one spot. Let's do that again. Let's just do another quick poll. What if who's using these different sources? Put A if you're doing field medical, then you can also add B as another submission, C, D. Just let's see what kind of sources you're all using. Because see, most people will start with we're doing field medical insights, and they'll do field medical insights, field medical insights. It looks like people will do advisory boards. You're looking at MedInfo. That's fantastic news. It's amazing how slow sometimes the MedInfo data gets pulled in. I'm actually working with a team right now that are deploying key insight questions into the MedInfo systems so that you can actually collect the structured data there too, which is very cool. A lot of you are doing social listening. Find out you're getting patient advocacy data or patient data. Fantastic. So you're already collecting insights across multiple sources, which is excellent. When you get them in, combine the reports and report based on the question, not based on the source. Hey, we had this great advisory board. Here's everything we learned. 3 weeks later, hey, we had all these field insights. Here's what we learned. Hey, 2 weeks later, hey, I just got this social listening report. Here's what we learned. Bring those sources together, use your deployment process, right? Going back to this, use your deployment process in order to coordinate across all those sources. Okay, great. And then the last one is to provide coaching. Okay, coaching. So coaching is really, really important in insights. I spend a lot of time, people on my team spend a lot of time reviewing and reading insights and then meeting with leaders, meeting with their teams to help continue to improve the source of the insights. Now, from a field perspective, if you're coaching insights, I suggest that there's 3 questions. The first is, did we take the opportunity to learn? Okay. Remember, if we are having these engagements and interactions in order to bring in enough data to help have confidence in the decisions, well, then look to see how often we're bringing that data. I know we hate to count widgets, but are you taking the opportunity to learn, or are you only taking the opportunity to share new information? After that, then look at the free text and the structured data and really evaluate whether that unstructured data is connected to a key insight question or not, but does it explain why an HCP has a specific belief? We see so much stuff in the systems and the reports where it's just data, it's just information. It doesn't explain why an HCP has a belief. So really look for that. And then the continuous improvement mindset, right? This is a skill that we can all get better at every time we practice it. And so the most powerful question that you can ask as a coach around insights is, what question could you have asked to make this even more insightful next time? So when you're having a coaching session, you pull up examples, you look at real examples. Fantastic. Yes, whether you graded an A, B, C, or D for the quality of that insight, always ask, what question could you have asked next time to make this submission more insightful, meaning a deeper understanding of why an HCP has a particular belief or takes a particular action. Okay. So those are the 3 things that we see the very best of our teams doing around gathering confidence building data, especially from the field. By the way, has anybody here started using AI as an insight coach? We've started doing this. We've got a couple of teams practicing with it right now. It's really, really cool, right? As they're submitting the insight in our platform, the AI is actually reading that insight, saying, wow, is that explaining why an HCP has a belief? Is it free of compliance concerns and patient data and AEs? No, you can kind of provide that coaching in demand. I'd love to share with you, but we don't have time to get into AI today. But if anybody would like information on using AI at the point of insights for coaching, just put AI in the chat and we'll send you something different about how to use AI for coaching. So, okay, great. We have several folks looking for that. Wonderful. The last of the 3 roles, very important now, is to actually facilitate insights process into action. Okay, so there's three things you can do to help make sure that the insights that you're generating across the sources are, are actually being acted on and used within the organization. Okay. The first is that your analysis should answer the questions. So if you go back to that strategy and you go back to the key insight questions, we need to organize our analysis around those key insight questions, right? I can't tell you, most of the time when teams are first starting with reporting on insights, they're doing it based on time and source versus based on what data do I have to help answer a specific question, right? It starts off typically as here's what 10 random HCPs said last month, and some of this stuff is insightful versus starting with here's the question that is trying to be explained, and here's the data. Now let's use that data to make a decision, right? So revolve all of your reporting around that key insight question. When doing that, make sure that you're reporting on trends and patterns in your data. You can use AI, again, to help summarize the why. So if you see a spike, if you see something that stands out, you can look at all the surrounding free text and narrow down why do people believe that? Why do people take that action? And then one of the most important things that you can do as an analyst is to look at similarities and differences. Okay, similarities and differences is what drives insights, right? And that difference could be by geography, it could be by source, like, isn't it interesting that people are telling our MSLs this, but they're saying something different on social media, or they're telling our field team this, but when we got people, some of the same people, into an advisory board, they're saying something different. So what is causing the difference between these different sources? Look at specialty. What's one specialty saying versus another? And then be looking over time. The insight is in the differences. Look for them and make sure you rectify those in your analysis before you present it. Don't just list, some people say this, some people say this, some people say this. Do the work to find out why. Okay. The second is to have a very specific insight to action meeting. Okay. This is the review of the study, right? This is the data readout of the study that we're calling insight generation. When you are facilitating this, be sure to evaluate as a team, how confident are we in this data to make a decision? And what would the impact be if we took that action? And then what's really important as the insight lead, don't stop until people commit to the action, right? And that action could be something like, it could be a big strategic action, like, hey, we're going to put something in our medical plan. It could be where we're going to prioritize some extra education. It could be an internal action, but document, write down the decisions that were made. And by the way, a very valid action that you can take is to generate more insights because we learned something that if we get the answer to would lead to a decision, right? And by the way, this is where organic or unstructured insights that aren't associated to a key insight question come in, right? Hey, here are some new signals that we're hearing. Here are some new things that we're starting to see. Do any of you think that some of these things might impact a decision if we learned more? Great. Now let's go through this process to actually get enough data in a more targeted and structured way to do that. And then the last thing, and this is so important, it is, and you as the insight lead role are probably the only person in the organization can do it, is provide feedback. Everybody involved in what medical affairs claims to be one of the most important things that we do needs to understand if their work was important, valued, and used, right? So be sure to go back and you have all this data coming from all these places. Make sure you share, here is what we learned. Here is a decision that was made. Here's what's going to happen next, so that people feel valued, so that people understand. And guess what? This is what motivates them to continue delivering, right? And continue to provide insights. So those are the roles, right? Prioritize and direct the insight strategy, gather confidence building data, facilitate an insight to action process. And these are the things that you do around here. Now, as I said earlier, sometimes it is more important to, it's more about what's caught, not what's taught, right? So some of you are probably doing some of these things and it's going great. Some of you might find one or two that you go, wow, this is the thing I needed to hear today. Could you please, in the chat, what was the most important thing about these roles and this framework that you needed to hear today that you will take and go do something with tomorrow? Put that in the chat. Okay, having the insights to action meeting, framing those kicks as multiple choice, love it. How to organize the data for the insights to action meeting, asking the why. Okay, yep, insights should generate why does somebody have a particular belief. Deb, several AI and coaching in the future meetings. Yes, continue to fine tune that. The insights to action meeting, how to define alignment measures. Fantastic. Keep going. Tell me more. Comprehensive checklist to assess performance strategy. Yeah. So to assess performance and strategy. Yeah. So, this is a really important part of explaining our impact. We've done other sessions in the past about performance and we talk about impact and activity, and they're both important, right? But if we don't have an impact part of that performance statements, people focus too much on the activity, right? So we have this leveraging multiple courses into one, define alignment measures. Love it. Thank you, Teresa. Reporting trends and patterns. Yeah, if we just report on a summary that some people said this, it's going to be hard to drive confidence in the actions that we're going to take. Fantastic. So thank you all for joining. We're not quite done. Last thing that I would suggest. So all of these pieces, right? All 9 of the skills that are here are important to practice, to learn, to find best practices on. Now, for those of you who are on the line that are Quello subscribers, we have insight workshops on all of these things and about 15 others. So you get those as free, is included in your subscription. So make sure that you remember you get those for free. For everybody else who are not Quello subscribers, this was so much fun for me. I enjoyed it that I want to do another one with you. So take a moment, please, and just write down in the chat just a couple of words. What would be the next workshop that would be most valuable to you? What would be the workshop that's most valuable to you? And just put it in there. It could be one of these things. It could be the insight to action meeting. It could be how to write key insight questions. How do you leverage AI? Leveraging multiple sources, how to coach insights. Put it in the chat. Let me know what the big next item that you would like. And for those of you that are putting it in the chat that are Quello subscribers, your CSM will contact you and we can schedule it with you, with your team using your data, using your strategy, and we can actually get into more detail. For those that are not, we'll definitely prioritize based on your feedback here and schedule another session. So thank you for contributing that, leveraging AI. A lot of people want to talk about AI. AI is the future and it's here. Isn't that fun? Wonderful. On a final note, we do have one more webinar scheduled. It's going to feature Linda Trailer and Renew from J&J on how to demonstrate and communicate the impact of your medical affairs team. Spoiler alert, has a lot to do with insights, but it's how to connect internally generated insights, like the things we talked about today, with externally validated data like claims and other sources to be able to say, hey, if these are the clinical behaviors that we want to change, what are the beliefs that lead to it? And how do we collect data as a leading indicator to help know if we're changing those beliefs? And what can we look at later as a way of knowing if those beliefs turned into action? So that's coming up July 16th. You're all welcome to join. Please scan. I'm sure you'll get an invite also because Team Acceleration Point was so amazing to help me set this up. Thank you all for joining. This was a ton of fun. If anybody has any questions, please just put them in the chat and we will answer any other questions that you have.